Good morning, and would like to welcome you all to the Merck Foundation Health Media Training for the 7th edition of Merck Foundation First Ladies Initiative Summit 2025. Now, to begin the day, we'll start with a video of Jacqueline Bonde. Jacqueline Bonde is a Kenyan lady whose hands were chopped off by her husband due to infertility issues. Now, do enjoy the video.
Jacqueline Wende, a 27-year-old young woman from a rural place called Masii in Machakos County, Kenya, tells us her sad story of having both hands chopped off, not by thieves, but by her own husband, for failing to conceive, even though he was the one with a fertility problem.
Mandi ndio nilisikia akigonga mlango akiniambia Jackie nifungulie. Niliachana na chakula nilikuwa nakula, nikaamka nikaenda nikamfungulia. Kitambo nimfungulie ndio alinikata hii mkono. Nikaanguka hapo chini na akanifuruta nikaenda nikaanguka huko chini. Kitambo nianguka huko chini alikuwa ananikata kichwa na mikono na uso na akanidunga hapa na kisu na hiyo panga alikuwa nayo. Aliponichapa nilimuuliza, kwa nini ngila unanichapa? Utaniua peke yako. Akanyamaza akaniambia, leo ndio siku yako ya kuongea, hautaongea tena maishani.
Merck Foundation came to the aid of Jacqueline through the Merck More Than a Mother campaign. She was provided with a new home and a supermarket to enable her to earn a steady income and become independent. Like Jacqueline, there are many other women that suffer from infertility stigma. Merck Foundation works closely with partners to empower them to be heroines of More Than a Mother movement.
Infertility is not just a woman's thing. It takes the two of them to have a child. So many treatments could make it right. So join her. Together yenyan muna dapat chonobi. Join her. Together yenyan muna dapat.
Jacqueline, I want to know that you are my sister. As long as I exist in this world, on earth, my faith is connected to you.
Yes.
So you have to understand this. You come back to me in anything, I will always be there for you, and my room is there. So I'm coming.
Thank you. Now, this video sets the pace for all of us to appreciate that issues of fertility and infertility is not just a woman's problem, but a problem for both the man and the woman. Our next section, our first presentation for today, would be on infertility prevention, the link between infertility and infectious diseases, and also male infertility. Now, to take us through this presentation is Dr. Edem Hiaji. He is an obstetrician, gynecologist, fertility specialist, founder and CEO of Lister Hospital and Fertility Center, and the immediate past president of the Fertility Society of Ghana. Ladies and gentlemen, with a round of applause, let's welcome Dr. Edem Ahiaji.
Good morning, ladies and gentlemen. It's always a pleasure to be with Merck Foundation, particularly the media talk, because we value the media so much. in this day and age of IT expansion, they are the people in charge, because whatever happens in Iran is seen everywhere in the world. Whatever happens in Dubai, Merck talk is already being streamed in your various countries. So it is a very, very important session where people understand. I find it so fascinating in that science is moving on very quickly and we are going to the nitty gritty of infertility, but at the same time, you need to be able to keep it at the basic level to explain it to the common man to understand. Otherwise, you're heading nowhere. So we'll quickly start. Um, so the link between infertility and infectious diseases and male infertility. Well, so the first thing we have to understand is how babies are made. Because if you don't, then you don't even appreciate what the problems can be. So basically, a woman would release an egg every month, usually 2 weeks from the beginning of the month. That will be picked up by the tubes, and then the sperm would have to be available at that time for just about 3 to 4 days. If you miss that time, then that month is gone. So sperm fertilizes the egg. Yeah, the egg fertilizes the sperm in the end of the tube. And then once fertilization takes place, it starts dividing. By the 5th day, it's at the blastocyst stage, and then it implants. Then when you do a test, you can find beta HCG that will confirm that there is a pregnancy. Now, what is infertility? When this natural process doesn't happen after a year of unprotected regular intercourse, and for regular intercourse, we say 2 to 3 times in a week. If you do that and for a whole year, you are unable to get pregnant, then we start getting worried that you may be infertile. This can be primary, which is you've never been pregnant, or it can be secondary. You've been pregnant before, but now it's becoming difficult to be pregnant again. That first pregnancy could have ended up in the delivery of a baby or an abortion, miscarriage. You've been pregnant, confirmed before. What's the prevalence? How common is it? The data says UK about 6%, USA about 10%. Sub-Saharan Africa, where the majority of us come from, and Southeast Asia, about 20 to 30%. This is a similar percentage here. Now, what are the causes? The male are responsible for 40% of the time, purely male, 40% of the time, purely woman, 15% a bit of woman, bit of man, and 5% unexplained. Now, in the developing countries, female infertility may be caused by mainly these endometriosis, where you have lining of the womb outside the womb giving problems, anovulations like polycystic ovary, where eggs are not released when they have to be released, hyperprolactinemia, the hormone that controls breast milk production and ovulation being too high, premature ovarian failure, where somebody's eggs get finished much, much earlier than they should, and then cervical and then endometrial factors. But in the developing world, the high level of infertility is due largely to consequences of reproductive tract infections. These are commonly infections from sexually transmitted infections, infections after abortion, or even infections after delivery. When this happens, the tubes get blocked. So that simple first diagram I showed you does not happen because the woman releases eggs all right, but they never enter the tubes and the sperms never meet the eggs to fertilize them. And how do we have proof of that? Because they tested the fluid in women who were getting pregnant easily and those who were infertile, and there was more infectious agents in the infertile women than the fertile ones. So when the infections happen, Then you get adhesions blocking the tubes, making it difficult for that simple process to take place. Infections can be associated with unsafe abortions, which lead to tubal blockage. And it's amazing that when I started practicing obstetrics and gynae, and I'm taking a history, and I ask the client, what kind of contraception do you use? And they say, no, 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 no. Then as you go on, then you get somewhere to do, have you been pregnant before? Then they say, yes. How many times? Then they will make a sign maybe 3 or 4 times. So to them, having a termination is not as bad as having contraception, because in our part of the world, when you start using contraception, it's thought that you're bad. You want to start having sex. That's why you're having contraception. But if you quietly got pregnant and went and terminated it, they didn't consider that a major problem. Asherman syndrome is when you have that termination and it's done badly and this overscrape the lining of your womb, the womb linings get stuck together, and then you also have another problem with getting pregnant. Then when we go to the developing countries, very few people actually get the opportunity to go to a proper hospital with good facilities without sepsis, that's aseptic conditions. And so a lot still end up with the traditional birth attendants or in churches where non-sterile delivery procedures are practiced. For that matter, pelvic infection after delivery is quite high. Then, where facilities are not easily available, you remain in labor for a long time, obstructed. When that happens, you have a lot of examination by the nurse, by the midwife, the doctor to comes in. All that is introducing infection until sometimes it's even takes too long that the head is stuck in the pelvis and blocks blood supply to the wall in front, which is your bladder, or to the wall behind, which is the rectum. So by the time you eventually deliver, or even if it's by cesarean, that tissue is dead and it doesn't take long, it falls off. And so you have a fistula, which is leaking of urine through the vagina or leaking of feces through the vagina. That is quite common in our part of the world. Then infections like tuberculosis and schistosomiasis may damage both the tubes and the endometrium. Also, the practice of female genital mutilation is usually associated with complications that lead to infertility. So, Merck wants to let you know that it is a problem that affects both men and women equally, and so you must share your treatment journey. You should both go to seek for help. Half of the time, it is due to the man. And the commonest infertility is one of the commonest conditions affecting people in their reproductive age. Get informed, support your wife, get tested. What's male infertility? This is the inability of a male to make a female pregnant, a fertile female pregnant, after a minimum of at least 1 year of regular unprotected intercourse. I've mentioned that already. And the common causes in the developed countries are hypogonadotropic hypogonadism, produced by tumors or functional failures in the pituitary and the hypothalamus. Okay, the production of sperms and eggs is controlled all the way from up, from the hypothalamus to the pituitary, then to the testes or the ovaries. There are hormones that control all that. That's going to be in my next talk at 2 o'clock for the fertility session. So these would be the common complaints or the common causes of male infertility in the developed world. In the developing world, by contrast, sub-Saharan Africa, for instance, sexually transmitted diseases, especially gonorrhea and chlamydia, account for a significant proportion of cases. These infections cause chronic epididymitis and occlusion of the vas deferens, leading to low sperm count or no sperms at all. In the olden days, it was gonorrhea, which was the commonest cause of infertility. Normally, typically in the male, you would have a whitish, creamy discharge, which would come on its own and very painful to pass urine. In the female, they would have also a foul-smelling discharge with a lot of pain, fever, and all that. But chlamydia is probably the most common cause now. So in the male, when that infection is picked up through the urethra, it goes into the prostate and the epididymis and would block this vas deferens. This is the tube that takes sperm from the testis all the way through the back of the bladder through the prostate for you to ejaculate. So once it's blocked, you may get other liquid coming from other glands, but then the sperm is prevented from entering the semen. Then mumps, which is pretty common during adolescence. When you get that, it's a virus. When you get that viral infection, sometimes it affects the testis as well. Mumps and orchitis together can lead to damage to the sperm production organs and lead to infertility. If you had previous hernia repair and it wasn't done properly, that tube can be caught, the vas deferens can be caught within the surgery, what the hernia sac may contain that, and once it's caught in, you will be made infertile. But normally, you should have had bilateral hernia for that to happen because there are two of them from each testis, one from each testis. So if it's one side and it's caught in, you still have the chance of using the other one. Varicocele, which is like getting varicose veins within the scrotum, tends to cause accumulation of blood within the testis. That tends to raise the temperature around the testis and makes it unsuitable for sperm production. God, in his wisdom, knew that the testis needed a lower temperature to produce sperms properly. That is why it's been brought out of the body to hang outside. So anything that keeps your testis hot will reduce your sperm production. Then there's sexual dysfunction like premature ejaculation, anejaculation where sperms don't even come out, or infrequent sexual intercourse, or retrograde ejaculation. Sometimes people ejaculate, but instead of coming out of the penis, it goes into the bladder. So conditions like badly uncontrolled diabetes can also lead to retrograde ejaculation. And then erectile dysfunction where there's sperm, but you can't get the hard on enough to be able to release it. So share the treatment journey, and in men, limit your alcohol intake, avoid drugs, stop smoking, and that would improve your fertility. Talking about temperature, those who have to be on the motorbike for greater part of the day, warming their testis much higher, those who always want a hot bath, if you're having difficulty impregnating your wife, then maybe you should go for a cold shower. What is the societal impact? It's a major cause of marital disharmony in Africa, exposes women to ostracization, social discrimination, and physical violence, as we saw in the movie that preceded the presentation. India and South Africa, for that matter, infertility has significant negative social impact on the lives of the infertile couple, particularly women, with frequent experience of violence, divorce, social stigma, emotional stress, anxiety, depression, low self-esteem. In all parts of the world, it always puts the woman in low self-esteem. Prevention. What are the preventive measures? Now that we know how it can occur in men and women and what the causes are, then we can start to talk about preventing it. As indicated earlier, major cause is from pelvic infections. So it's better to prevent the infection than to let it happen before. Primary prevention consists of prevention of sexually transmitted infections, post-abortal infections, and post-delivery infections. So that needs education. And this is where the media comes in. Community education on behavioral change and modifications of sexual practices, effective contraception, including particularly barrier methods of contraception, is very important. It reduces the number of unwanted pregnancies, and therefore the infections post-abortal will reduce once contraceptives are taken on. Similarly, the provision of effective maternal care services will help to reduce puerperal infections. This is at governmental level, but the media, again, is there to talk about it. What about secondary prevention? This involves early recognition and aggressive treatment of sexually transmitted infections. So when you find that it's possible you have an infection, don't just go to some chemist or pharmacy and say, oh, I want antibiotic. They just give you something. You take it, it seems to have subsided a bit, but then it's not completely gone because they never really tested to find which organism was causing it. And so it then becomes a chronic infection, and that even has a higher chance of making you infertile. So yeah, go to a health facility, do not self-medicate. Then tertiary prevention, use of methods to mitigate the effects of infertility in couples include systematic counseling with conventional methods, where cause is not a problem, use of one of the newer methods, where infertility is irreversible, counsel couple to accept their fate and consider options of adoption or fostering. Okay, now the tertiary area, that's before it starts affecting the couple to the extent of ostracization and all the other complications that come in. They need to be properly assessed to see if one of the newer methods of fertility treatment like IVF, etc., can help. There will be somebody taking you through those. And if it's not possible, then there's still adoption and there's still fostering. In many parts of the world now, and particularly Africa, with the advent of Merck support to bring advanced fertility treatment to the developing world, we are being able to manage most cases of infertility. Where the tube is blocked, you bypass the tube by doing an IVF. So you get the egg out, get the sperm, and it can still help. Once you form the baby and the womb is good, you can still get pregnant. So you look at all the possible ways, and if that doesn't work, there's still adoption. There are still many unwanted pregnancies that need a home. And so you can then counsel on those. Yes, so those are the options, which I'm sure someone will take you through. Control ovarian stimulation with timed intercourse, intrauterine insemination, in vitro, cytoplasmy, testicular sperm collection where the tube is blocked. You can still do that. Gamete donation, surrogacy, adoption. Public awareness and health education. Yes, infertility should not be a stigma. It can affect anybody, but besides the negative impact of HIV on the body's immunity, it can also affect the body's ability to produce the hormones that are required to fall pregnant and may also lead to early menopause. So as you look at the broad aspects of health, that is also important for infertility. Chlamydia and gonorrhea, I mentioned earlier. If untreated, these silent infections called pelvic diseases can lead to all those complications: chronic pelvic pain, ectopic inability to fall pregnant. Practice safe sex, condoms, and then the other infections which can cause infections. Smoking, alcohol, drugs, all reduce your fertility. Remain healthy, eat balanced diets, because if you're too fat, it affects your hormones. If you're too thin, affects your hormones. Try and have a lifestyle that would keep you fit. Limit caffeine. Okay. What are the key take-home messages? Infertility is not a stigma. It affects both men and women equally. You saw the statistics at the beginning. 40% all women, 40% all men, 15 a mixture of both, 5 unexplained. Get informed. This is part of it we're doing now. Support your wife. It's a shared responsibility. Thank you.
Thank you, Dr. Adam, for sharing in-depth information with us. And for a key takeaway, fertility can be prevented and is a shared responsibility. Also, that infertility affects men and women equally. Before we move on to the next session, we would like to screen our animation film More Than a Mother, which is created to raise awareness on infertility stigma and to break it.
I'm a woman, I am fruitful, beautiful, in and out.
In a land far away lives a man called David. David is married to Jane, his childhood love. David and Jane are wealthy due to their hard work. 2 years ago, David and Jane went out in their farm to work. They were saying lovely words to one another.
My love, Jane, I love you like I never loved before. You are so amazing. A virtuous woman indeed.
You're the best husband in the world, David.
A lady called Mama Bomboy and her son Chukudi passed by David and Jane's farm.
Trudy, let's say a good hello to David and Jane. I think you know them, don't you?
Yes, I do, Mom.
I wonder how they can be happy like that when they can't have children. The woman is infertile. I need to let them know how miserable they should feel. Hello, lovebirds.
Hello, Mama Bomboy.
And then,
How can someone barren like you, Jane, pretend to be happy? You should be mourning and hiding your face.
Oh no, not again.
You should give your husband a child or else return to your parents. David doesn't deserve this. He is a kind man.
and Jane started crying.
Mama boy, how can you be so cruel like that? What did we do to you? Let's go, my boy.
Jane, my love, please don't cry. You know how much I love you. Don't mind anything she says.
She just said that I'm barren. You know, I also love children like every woman.
Don't think about what she said. And I don't mind having children.
David and Jane were happy once again. 1 week later, David's friend invited him for a meeting. On his way to the meeting, David was wondering what kind of business his friends wanted to discuss with him. He wondered if his friends wanted to buy all the yield he gets from his farm, or if they wanted to offer him some money to invest in his farming business. Finally, David arrived at the meeting place.
I see them in the corner. Hey, long time, my friends.
Hello, David.
What business do you have for me?
You see, David, we have been thinking about you. We know you are sad because your wife is infertile. Let's help you and find you a fertile young wife.
What?
Musa is right. We think you should leave that miserable woman you have as a wife.
Okay, now I see the kind of business you called me for. Let me tell you something. I can never leave my wife. Infertile or not, I love her.
But David, not all women are barren.
Let's leave this discussion here.
The next morning, David decided to take his wife Jane to the hospital to seek some medical help.
Jane, my love, I promise to do everything for you to be treated.
Thank you, David.
At the hospital.
Hello.
Hello.
Doctor, I have brought my wife for the treatment. You think she is infertile?
That's okay. But you can't tell before we do the test. It might be you who has infertility.
What? Me? No way. A man is never infertile.
Men too can be infertile. Let's hope you two are just fine.
Let's hope.
After doing all required tests, it was David who had the problem that was causing the infertility. David had a low sperm count. The doctor told them that
Intrauterine insemination (IUI) procedure is required to be done.
David and Jane agreed to the procedure. The doctor told them
Many cases of infertility are treatable once they are diagnosed early. The following are major causes of infertility: poor nutrition, untreated sexually transmitted diseases such as chlamydia and gonorrhea, consequences of infections caused by practice of female genital mutilation, unsafe abortion or unsafe delivery, the use of herbal douches and enemas which lead to pelvic infections and tubal blockage, exposure to smoking, leaded petrol and other environmental pollutants.
David and Jane agreed to undergo the insemination IUI procedure. At the hospital, David waited patiently. The doctor placed David's sperm inside Jane's uterus to facilitate fertilization. Jane took a pregnancy test after 14 days and she was pregnant. 9 months after the intrauterine procedure.
Do you have a name for this little cute in the womb?
I think I'll name him David.
They both smiled and went on. It was time to go to the hospital to give birth. David and Jane were happy to finally have a baby.
I am happy now. I am a father.
No, David. You are more than a father. You were more than a father even before we had this baby, Ameche.
Yes, Jane, my love. You are also more than a mother. My friends, I have learnt that infertility is not a curse. It's a condition that affects both men and women and can be treated and prevented. No one should be stigmatized because they are infertile.
I apologize for the bad words and foul mouth.
Now I have learnt my lesson. What you are saying is right.
Woman, I am fruitful, beautiful, and out. I refuse to be discouraged. My joy overpowers the sadness. More than a mother, it's more than having a child of your own. More than a father.
Now we invite our second speaker for the session, Dr. David, consultant obstetrician, gynecologist, director of Women's Health and Fertility Specialized Clinic, Rwanda, and also our Merck Foundation alumni. Dr. David will highlight for us fertility management options, messages for the community. Dr. David, sir.
Good morning. Good afternoon, good morning, those following us online. I thank Merck Foundation for giving me such opportunity, to talk about infertility in our community. And while addressing the media, as the media, we have a great role to play in our society, especially in Africa. Africa, in Africa, when we face these issues of infertility, like as my colleague, my seniors have said, really Africa, the media, we have a very big role to play in regard to this, because in Africa, we face a lot of policymakers, be it in our ministries, they face challenges of, tropical disease, HIV, so many issues, poverty to handle in Africa, especially when it comes to our policymakers. So as a media, you have a great role to play to inform the community about infertility. And be it as a human being, we have the right to have babies. We have the right to have children. Every family has the right to have children. And in fact, we see in our region, everyone is born, get married, you have to get a kid. Though there are some couples that decide not to have a kid, but that's their right. But the first right, which even the Bible says, is that go and have children. That's the first thing they do. They tell us when we're in church. So this issue shouldn't be ignored. We thank Merck Foundation for really bringing up, this awareness and building our community. You know, in our setting, if you don't have a child, development doesn't continue. Development, you know, in our society, you see young men, women, they are getting married, but because they don't have children, they can't own a land, they can't build plot together. Development doesn't incur. So we inform the policymaker, our governments, that please, the infertility is become an issue and shouldn't be ignored. It's be treated as, you know, as the other disease. It's not a luxury, so we must really respect and help. So here, the media, we have to play a big role, especially in Africa. You know, in Africa, our society, they always believe in witchcraft. You know, after marriage, even during the marriage ceremony, isn't it a witchcraft? Maybe we're doing giving us gifts. People think, because I'm now talking from my own experience when I'm treating patients. They come to my office, they say, oh, maybe they were bewitched. So you start thinking, these are thinking, it's not bewitched. They think maybe family wrangles, they don't like, you know, we've seen all this. They come crying in our offices. But please, when we get opportunity, you as media group, to approach us in our consultation, you know, for us doctors, we don't have time to inform the public. But if you're like, for example, you are in my setting and you're a media person, come to my office, ask me, what can I do to inform the public? I'll always give you all this information, and they'll be crucial to our community. Don't fear us in our consultation. Please come. You have a big role to play. So they also other the thing that is spiritual forces. And I think that, oh, maybe there are spiritual forces, things that we never respected before marriage. Please, as a media group, raise awareness. It's not spiritual forces. It's about the fact that our seniors have talked. It's about biology. There's so many factors we've had infection. Others, they think there are some culture taboos that I never respected. Maybe I changed the religion. Maybe my family was telling me I'm a Catholic, I changed it to be a Muslim. Maybe those are thinking that we should raise. It's not about culture taboos, please. That's why the media you have to come in and play big role. Others, they say it is God's will. They start to think, oh, maybe it's God's will, we shall have children. But please, as my fellow colleague says, women are time bound. Let's inform the public that women are time bound. Not every woman that goes into periods can conceive. No, not every woman can conceive. And if you see period, some women go to age of 50 and, oh, I'm still seeing period, I'm 50. Maybe I'll give birth. No, please. Infertility is also time bound. Don't delay. Think about it. Don't say God is will. No, I see women at the age of 40s, they are coming to me that we are facing problem infertility. They sit back. No, whatever you have, whatever assets you have as a family, you can have now a child. Don't think that infertility treatment is very expensive, because we see that in Africa, many couples, they have farms, cows, land, and now see you have farms and cows, and you not bring this money to be utilized to have children. Now, what are those things you're keeping assets for? Do you think that infertility should be the last option to be thought of? No, please, infertility now, it goes with modernization. You can have a child, stop everything they have. Also, some partners, they think that they're incompatible. So please, I always hear couples, they come that, oh, maybe I have blood group A, you have blood group O, we are not compatible, so we shall not have children. Please, let us inform the public. Getting a child is not about incompatibility. It's not about blood group. You can be a black, you can have children with the white, you can have any, because this is God's creation. Please, let's break the stigma about incompatibility. It doesn't exist, please, the media. So another thing is that we have to talk about abortions. Sometimes you find that the community, once the couple, they live together, they start to accuse each other. Maybe you had abortion, you had what? This is the cause of infertility. No, don't think about abortion. There are so many different lifestyles, as my senior said. You can. It's not that your wife had abortion that caused not conceive. No, there are so many things that you can tackle. It's you, the media, to address the issue. Don't think that you start backbiting each other. Maybe she had abortion. No, there are so many things that can bring about to deliver, not abortion. So the other thing is that the use of contraceptive. Some couples come in our settings and they say, "Oh, maybe my wife had contraceptives." No, it's not about contraceptives. It's about other causes that you have to understand. So please, media, help our community raise awareness, and our society will have proper development. Without a child, no development can happen. So much of the slides that I'm going to share with you, they have been talked about. We don't have to delay much on them. So the plan was this: to talk anatomy, physiology, the main cause of infertility, female causes, male causes. All these, my senior talked about them. I will not lay on them. You know anatomy, you understand. Maybe what I want to emphasize that the picture can talk more than the words. You find that most of the women, they come to our office and say, "Oh, maybe when we do sex, all the sperms come out." But what I want to assure you is that you don't need you have to tell the community that when you have sex, of course, the semen, the ejaculate, comes from the prostate gland. There's gland. So not all this that comes out has to go into into the woman's part. With it, there's some sperm that is made by testes that is only has to go to fertilize the woman's egg, because now the only sperm comes from here, and there's so much fluids that come from the glands. So another thing that others, they tell you, "Oh, maybe there's some position you have to take when doing sex to ensure fertility." No, even someone who has been raped, it can, even if you ejaculate from even outside near the woman's vagina, you can get pregnant. It's just that there are some sperm that are here that move like as fish moves. So another thing is that this sperm, they need to move, and the water, the semen has to come out, and the sperm has to move. It's not that the man ejaculates that has to go inside. It's what some women do. That's why even when you do IUI, we remove the sperm, and we leave out the water part. It's not that ejaculate that we push inside, no, because it's also dangerous and has some germs. So we talked about this. We don't have to lay on this, but what I want to emphasize is that we have to inform our society that after ejaculation, there are these sperms that they need to find a way to go and find the egg. It's not all the water that a man, and not every man that ejaculates that can make pregnant. Sometimes it can be content of water without these sperms. So we have to inform the society to know about that. So this is how fertilization takes place. We all know this. We have to inform our society that please, we have to prevent infections that can hinder this passage. This passage have to be protected. With current situation, our young girls, they are going into sexual behaviors as early as possible. We have to inform as a media, the public, that all girls, if you prevent your passage to be virgin until marriage, it will lead into your protection. This Fiona from Uganda was asking that this Brighton ovum. Imagine if you get this Brighton ovum before marriage, and they are blocked, or unsafe abortion, you spoil your passage which God created. So stop any unwanted behaviors, especially sex before marriage or unsafe abortion, which will bring infection to this part, which is great. So I'll not say much about the causes. We know that there are many male causes and female causes. As media, we have to understand there's many male causes and many female causes. Please don't try to know that we have a culture in Africa that if a woman is not having children, I can have somewhere another one. like someone who was asking. But the cost of wanting to have a woman outside is higher than approaching us to help you in the cost. First of all, there's a cost which is really more costly to have a child, a woman outside, than having you bring your wife. We treat you, you get children, and everything as God planned, you have it. It's not costly these days. So, as my colleague said, they are female factor, they are unexplained, they are both. So please, as the media, let us really inform our public about this. Those in New Times, those in writing papers, please help us address these issues. So all this was talked about, infection, the treatment part. Is very difficult to you as media to understand the treatment part, but please approach us in every country where you are. Approach doctors to inform the public, and we shall get the ball moving and help our society. So we talked about this. In Africa, we have high rates of couple infertility, stigma. All these I talked about. I'll not lie about it. So, let us help each other. There are some, sometimes you may find a general practitioner. Even, infertility treatment is about levels. As you see, the government has health centers, a hospital of referral, a tertiary institution. Even infertility, it can be helped on the community level. Like you, the media, you have a big role to play, and this big role can be utilized on the community level without even coming to the hospital, like lifestyle, everything. All these things you have to understand and help us. So we have levels of managing infertility before even before encroaching. We don't want to manage infertility at advanced, ages. The more you advance in age, as my senior said, the more it becomes complicated, but because the eggs are aging. By the way, there's one thing I want to talk about is that, but you have to inform our communities. Like, we have now technologies. You can freeze your eggs. For example, you can be a young girl, a woman, you're still advancing your careers, and you're not yet found the right partner. Know that the technology, you can freeze the eggs. You can keep your eggs. Instead of coming to us at the age of 40, when you have had your right partner, that I want to get a children. Know that nowadays you can keep your eggs advance. You can keep your eggs, freeze them. Do you know that keeping your eggs in your body as you're aging, it hinders giving a child? So better inform the public that you can keep your eggs, freeze them, continue your career. Even if you come at the age of 50, we can give you back your children, your eggs, when they are okay, than advance your career, then come at the age of 40 that I want to have babies on my own. Then we tell you, please, your eggs are now old than that are older to your egg, because your eggs will be affected by the substance, by the how environment affects your eggs. These substances we've been hearing from our seniors, all this environment pollution. Your eggs are better kept somewhere than going with them. I had a colleague, a friend, who was married to, he was white, he was married to African guy. Now this African guy divorced this white lady, and the white lady said, "Oh, doctor," because I've been following them like for quite some time, a few days now. This guy, African guy, divorced this white man, white lady, sorry, and now this white lady is, "Oh, now my friend had divorced me because I've not conceived. Let me go to my home area. I freeze my egg. By the time I get the right partner, I use my egg." I said, "Oh my God, this lady, she's understanding." So also let's inform our couple, our community, that even if your husband, it divorces you because you're not having child, you can freeze your egg, and by the time you get your partner, you can utilize these eggs, please. So they shouldn't feel depressed, isolated, because they are not helped.
Thank you very much, Dr. David, for that brilliant and insightful section. Dr. Haji said that the success of fertility issues mostly depend on a woman. And I'm sure that if you're a woman here, if it sank deep, you are thinking about it now. You would agree with me that fertility issues is linked to psychological issues. It has psychological impacts. So we are now coming to have a presentation on the influence of infertility stigma and other social issues like gender-based violence, child marriage, female genital mutilation on women and couples, the social and psychological impacts. To do that with us is Dr. Francesca Bulwaya. She is a consultant psychiatrist at Chinyama Hills Hospital, National Mental Health Coordinator, Zambia, and a Merck Foundation alumni. She will also speak on how the media can create a sense of community sympathy and how to write inspiring stories on infertility stigma, linking it with the social and psychological impacts. Good to have you, Doc.
I think you're now mini experts at infertility for today, right? What infertility is, its prevalence. I think those discussions have already been done. And I think for me on this slide, what I would like to emphasize is accessing fertility care, we should agree, is a challenge currently for us in Africa, right? And the Mediterranean region, and due to various reasons, and stigma being one of those major factors has already been highlighted. And that speaks to many aspects: our culture, religious, traditional influences. And for you as the media, I'm sure you are well vested in understanding contextualizing communication, contextualizing various issues or challenges that different communities face. So I think most of the statistics have already been shared as well. But I think one statistic that I feel that can simplify things and make us think is 1 in 6 individuals experience infertility in their lives. So just in this room, if we count 1, 2, 3, 4, 5, 6, amongst those 6, an individual may have experienced or will experience infertility at some point in their life. And that's a significant number. Me and technology. Okay, great. So just looking at this image, right? If we pay attention, where is the darker shade of pink? Just a millisecond, a few seconds look at this image, we already guide where the burden is. I know there's this misconception that in Africa people are fertile, or in the Mediterranean region people are fertile, or the Asian region, right? These are the understandings that we have, but statistics are showing the opposite. So are we understanding fertility in our context? And I think that's where a lot of these misconceptions come, where women won't seek support and will probably give other reasons for their lack of fertility. Because our belief in these regions is that we are very fertile. So understanding the population, its context, I will not go into this. I think Dr. Adam did a good job giving the various factors that cause infertility. Why is infertility important? Why is it important? Because firstly, it's a human right. It's a natural expectation that most people would have, right? To reproduce. And other than that, of course, nowadays there are certain individuals in other cultures who are now choosing not to reproduce for various reasons. Again, they have the right to that. But in general, globally, it's understood that most individuals will actually want to produce, and that should be a right of every individual. And that's why we're speaking about this. Then it will mitigate gender inequalities, especially amongst the women. We saw the video and we saw the impact on that woman's life. And there are many other such stories of women who've experienced a lot of trauma because of their fertility journey. And it has also caused a lot of disruptions in homes, in families, and in the community at large. Hence, we need to talk about this. Divorces, mood disorders amongst women, amongst children, in families, disruption of families. This topic is important. Then allow me to also speak about other associated factors to infertility. Gender-based violence. 1 in 3 women is experiencing gender-based violence. And sometimes we feel like, I think we've spoken a lot around this issue. So I think a lot of women are getting help, a lot of women are getting support, a lot of women are reaching out. Oh, nowadays, even men, by the way, as much as we are emphasizing on women today, right? But the reality on the ground is that many women are still not seeking support. Many women are still struggling in silence. Even educated, exposed, that's not even a distinguishing factor. So, what more can we do? What role does media have to help more women to seek support, to help more women to speak out? Because it still remains a major barrier. And when we talk about gender-based violence, a lot of it tends to, that is usually highlighted as the sexual violence. But is it only sexual violence? There's more to it, right? And let's be deliberate to report around all the other aspects. A lot of it is sexual harm, physical harm that's reported, where there are issues of rape or sexual violence or child marriages. There are also various issues of physical punishment or domestic violence. But how many of us are talking about genital mutilation? It's a taboo to talk about it, right? But is it for the media? What role does the media have concerning such conversations? Mental harm, verbal abuse, emotional abuse. Are we being deliberate to highlight that as well in the conversations that we're having on the various media platforms? Economic manipulation, various economic studies have been done, and they show that a lot of the breadwinners in these homes in the African and Asian community, you might find that it's actually women who are sustaining these homes. Is there an aspect of abuse there? Manipulation from the other gender? I know it's usually understood that it's women who abuse men, right? For their money. So can we have conversations around those? And a lot of this violence is with intimate partner violence. And that's what complicates it, right? There's so many emotions, there's so many attachments. How do we guide people to navigate those complexities? In practice, what I've noticed, you report, you attend to this person, you give them knowledge, you start the journey of allowing them to get support or get alternative approaches to the situation that they're having, they disappear. Or that process is just halted suddenly. What are those factors? Are we deliberate to research those factors in our different communities and highlight them and speak to better approaches or support that could help these communities? Or are we reporting as usual? What we saw people report in a different context, we also just replicate. Because I'm sure, especially in certain regions, like I know in the African region, there's a lot of training, there's a lot of support for GBV, right? But you'll find some of it is not contextualized. Maybe the material is westernized, which is okay, which is good. But are we being deliberate to adapt that information so that we can communicate in our various localities appropriately and in context? And when we talk about violence, it doesn't only affect women physically, emotionally, psychologically, socially as well. For others, they're beaten so physically, they won't be able to go work or go do their business, which affects their income to their home. And mentally, another aspect which is usually neglected. How is she doing emotionally? Has anxiety crept in? Has depression crept in? How is she coping? Is she struggling? A lot of times those aspects will be ignored. Let us emphasize those aspects of this presentation because these are actually preventable aspects. What guidance can we give these women or men? When it happens the first time, what do you do to avoid the chances of another one? What support can they get as a couple if that is going on? Or in a family setup, if it's maybe guardian to children? How are we deliberate about offering solutions to support services as the major house? I know these are some things that you actually know. My role here is just to remind you, to bring you back to that reflection, to allow you to be conscious again of this and make commitments to deliberately prioritize these communications. Another aspect that I'll touch on, child marriages. Because all these have an impact towards infertility, right? Have we seen stories whereby someone is physically beaten, that they have injuries even to their reproductive organs? It affects their fertility. Someone is significantly mentally ill, depressed. Are you expecting this woman to be fertile and apply herself or her body? No. So all these are connected. Child marriages, one would say. Let's look at the global map. You see the darker shades are indicating the intensity. What do we see in our region? Why are we talking about child marriages? It's quite high, right? Very, very high. Why are we talking about child marriages? Yes, it violates the right of this child or this woman. But again, it brings in other risks that we've been talking about in relation to infertility. Early pregnancies that may have poor outcomes, affecting their fertility along the line, or miscarriages or pregnancies that will be terminated, maybe not in the best way, affecting their fertility in the future, and also a risk of infection, various STIs at an early age and early exposure, affecting their fertility journey as well. All these aspects are coming together. And it's actually a high cause of mortality among young women in sub-Saharan Africa. So we need to talk about this. Then allow me to also touch on genital mutilation. Do we think genital mutilation has got any medical purpose? No. Thank you. I like that response of no. Others I noticed had a blank face in the crowd. It has got no medical purpose. Of course, there are various reasons why different communities practice it due to various traditional cultures or expectations or myths. Let us curb this activity. And a lot of them are not done in an appropriate setup, right? Because it's got no medical reason. So why would someone come to the health facility and the medical personnel start conducting such a procedure? Increasing issues of risk, infection risk, bringing back to those issues of infertility. And it is predicted that by 2015 and 2030, about 68 million girls would have experienced female genital mutilation. That's a significant number. What can we do about this as media? I was surprised the first time when I had to present on this. It's not something I'd even really paid attention to. I think I'd probably followed a YouTube video on it once, but I overlooked it and I just thought, I'm like, oh, probably it's just a small group in Africa that practices it. Then when I had to present on it and I had to read and research around it, I was amazed. I'm like, wow, that's the depth of the burden of female genital mutilation. It needs our attention. And it goes against the rights of these women and girls. Again, I like bringing images and pictures. I feel there's something that it does, even to our memory, to our understanding. Again, what are we seeing in this picture? Are we seeing the burden? Are we seeing the distribution? Those are significant numbers, even going as high as 90 to 99%. Are we speaking about it? So what's the social and psychological impact of these various presentations? I'll start with infertility. These women experience a lot of stigma, a lot of stress, a lot of pressure because of their infertility. As much as the experts have already shared that infertility is not only caused by women, it's both men and women, and it's actually equal. But how is that communicated or looked at in our various societies or community? Usually it's thrown on the women. And that's why today we're emphasizing and talking about the woman, but still highlighting the role of the man in this journey. Firstly, the pressure and stress that these women face is at individual level. Their self-esteem is affected, their confidence, their value of themselves. Before we even go to community, right? Because this is someone who's been being brought up in a certain community, which there are certain expectations that she should achieve, especially if that individual gets married, right? So that pressure, that stress first is individual and internal. Now, coupled with the external pressure of the community around them. And sometimes it's not just family, even random people in community. We saw the video, right? It wasn't even family, just a random person. So when are you getting married? When are you getting pregnant? For how long have you been married now? How come you don't have a child? You don't want a child. Inappropriate conversations, huh? I'm sure we see it around ourselves. What's our role as media? What can we do to sensitize the public on how to approach women or individuals or couples who are actually experiencing infertility? We need to educate our communities. Aunties, mothers, there are alternative ways that people can approach these individuals. So you find that these women experience a lot of stress, which leads to a lot of mental health challenges, a lot of them presenting with depression, anxiety, which further increases their risk of infertility through various modes, right? When the body is stressed, I'm sure you heard Dr. Edim explaining, it starts where? In the brain. Neurotransmitters, it's like the body is connected. So when this woman is highly stressed, the hormones up there, they dysregulate. This woman is depressed, she's not eating, she loses so much weight. Again, dysregulates, making the chance of fertility even worse. So let's have a holistic view or approach to this infertility conversation. So I think I spoke about others feeling like they're failure and even feeling embarrassed to actually seek support, right? Or to go to centers where they could get this support. Others will do it, they'll try to hide when they're trying to get this support. How do we normalize conversation of these services? What can we do as media? Maybe let me take a minute and hear from you. What do we feel are solutions to these conversations? In addition, I was glad to hear earlier on that the angle that was shared, right, about investing in their fertility. Of course, it comes at a cost because it's an investment, but that as well in itself causes stress to these women. Even just the process causes a lot of anxiety, the different steps, medications that they have to get, expectations through the journey. I hope it works. Oh, I've invested so much. Oh, I'm trying this maybe for the second time or third time. Can we normalize conversations around this so that the public can understand the burden of infertility and they can be empathetic to individuals who are walking this journey? Conversations maybe like surrogacy maybe are not even accepted in certain cultures. So again, contextualizing our conversation to our various contexts. Then what are the psychological impacts for child marriages? Firstly, these children are not mature enough to handle the burden of parenting another child. So the psychological stress is too much for them, beyond which they can bear. So let's spare them that. And also the aspect of early pregnancies and HIV infections, which later on affect their fertility journey. I was just speaking to one of the fertility experts yesterday. And in that conversation, something that he mentioned was that an interesting pattern that we're seeing is that some women who had a child earlier, years ago, then suddenly after some years, when they choose to produce again, for some reason they're experiencing some complexities. I haven't yet taken time to read the science around it, but it could be also related to the same. Early pregnancies with various complications in between, then when they're now mature, stable to manage it, they find themselves in complications. So what's the role of media? Do you believe you've got a major role in this? So what are you doing with this privilege that you have about this conversation? The media right now is so powerful that even myself, sometimes I stay away from the media to avoid its influence. You've got that much influence. What are we doing with it? Merck Foundation seems to invest so much in the media team. But with time, I'm starting to appreciate the role that media has, the power that you have, and how can you use it to achieve this goal. A major important aspect is awareness, educating the public. Speak about it, social media, TV, radio, in-person physical engagements. Let us make the public understand what infertility is, what can cause infertility in simple language, right? Why should they care about infertility? How can they look out for infertility? When does something seem normal and when does it become infertility? When can they seek help? Then very important as well, where can they get these services? Where can they be assessed? For me, I think a program where these things are actually being outlined. Yes, it might be a taboo or a difficult conversation in community, but who can normalize this conversation? You, the media, right? Advocacy. That's another issue or platform or approach that can be emphasized through media. Access to infertility services. Are you aware of how many insurance services actually cover the number of investigations or support that individuals need for infertility? Actually, very few. A number of insurance organizations or companies will not cover that. Are we advocating for such changes in policies? Are we creating platforms for such discussions? Why not? Oh no, it's expensive and various reasons. Like, but it is an illness as well, right? And that's why we're discussing it here. It's a condition, it's got a diagnosis in the medical diagnosis criteria, right? And that's why it's treated, and that's why it's got a treatment. Are we normalizing such conversations? And I think that's the power that media has. And it doesn't even have to remain just within our regions. This is even a global conversation because a number of these insurances are actually global insurance platforms, right? Can we start such movements? So that a woman who is struggling, the more reason why insurance should cover it, right? Because it's costly. Just some food for thought, just one area. Lobbying for health policies that support infertility treatment or support or follow-up or care. So very important as well, even as we create this awareness, this education, let it be accurate. Engage professionals. I know you are very good at your job and you do a good work of research, though sometimes the public bring out certain questions or aspects which can be helpful to have an expert as you disseminate this knowledge, right? For maybe the accuracy of certain detailed information. Or even in preparation for your media presentation, you sit with an expert, you have a discussion, several questions and clarifications around their presentation. And also public engagement within those programs as well can be helpful. How, even when we talk about the topic, how do we bring it out? Because again, I know sometimes people say, oh no, even negative media has its role, but for such a sensitive topic, are we sure we want negative media towards it? What words do we use? What angle do we choose when we want to talk about this topic? The angle we choose or the approach we use, is it improving people's perception towards infertility to gain sympathy and support? Or is it adding to the negative view and stigma towards infertility? Those are some of the things that we should keep in the back of our minds. Then having information that is detailed, even with reference and support support services attached to that. It's not enough to just inform people that, yes, this is this, it's a problem if you identify it. After that, what do they do? What next step do they take? I like to use this picture. I use it several times because it amazes me on what just an image can do when we're talking about communication or approach of communication. When you look at this image, how does it make you feel? Does it give you positive vibes or negative, negative vibes, right? Negative vibes, dark. And when someone looks at it, when they think of infertility, would they think of something good or helpful? Could this help to reduce stigma, or it could possibly add to the stigma? It's those simple things. It's even in wording, huh? Dark, right? So it's such things whereby we can think, okay, we're using this to attract attention, but are we sure? Is it really achieving what we are trying to achieve? I'll give an example, even just selection of words. Yes, women with this problem who can't give birth. It's even selection of words, right? Okay, women who are on a journey of finding fertility. Are we seeing the difference? And sometimes even the stigma is in just the small things, but which make a big difference. Even for a woman who's listening to your program, for them to continue listening to you, if it's coming out strongly negative, judgmental, they'll immediately switch, right? Because remember, these are individuals who are already experiencing so much within them. But if they see that it's positive, it's solution-oriented, supportive, empathetic, they'll now listen more to finish your program to actually get the knowledge that you're trying to put across. That's an important aspect I have noticed. And I think I've spoken on this slide. I tend to go ahead of myself. So media, you are powerful. You've got a great tool, you've got a great platform. Help us spread this journey in the correct and appropriate way. You're part of the solution. Think solution-oriented. Are you being deliberate as media to highlight houses or families, support groups where women with such challenges meet to support each other or to guide each other, narrating successful stories of women, identifying such stories and such women sharing, anonymous, maybe places that people can be linked to for support or services, reference to experts on the program, right? On social media, a link. I think I've done my part. Thank you.
Good afternoon, all. Now, before moving on to the next speaker on diabetes and hypertension, I would like to share with you all that Merck Foundation has created 2 animation films, Sugar-Free Jude and Mark's Pressure. The first animation films in Africa to raise awareness about diabetes, hypertension, and to promote healthy lifestyle. Through our new animation films, we want to encourage our communities to stop sugar, limit salt intake, exercise regularly, eat healthy, and never smoke. This is the only way to eradicate diabetes and hypertension, which are predominant risk factors for the development of several serious complications and heart diseases. Before we call our next speaker, we will shed some more light on this topic by this video of ours, our animation film created to promote a healthy lifestyle and raise awareness on the early detection and prevention of diabetes called Sugar-Free
Merck
Juice.
Foundation. No more diabetes. Reverse diabetes. Goodbye.
It's morning rush time to school, and Jude is about to take a big bite into his breakfast on the go. Jude loves donuts, especially sugar-coated ones.
I love the taste of sugar on my donuts. It makes my morning sweet with this juice combination.
Jude, don't you think your eating habits are too unhealthy? I am worried about the rate at which you consume sugar products.
James, relax. I can't wait to eat my lunch. More donuts? There's nothing to worry about.
Jude was not bothered about James' concern. He went on eating more sweet foods day after day. As the days passed by, Jude started noticing something quite unusual.
My goodness, not again.
Jude would wake up several times at night to wee wee. It was so uncomfortable. Not only that, but he also noticed that he would wake up very thirsty. Jude would need to drink water multiple times during the day as well as night, and this also meant using the washroom several times.
Oh my god, this is so destructive and shameful.
What is it? This appears to be the third time you woke up to use the bathroom. You even look a bit fat. Very unusual.
I have no idea, ma'am. And I've been feeling very thirsty lately as well. And sometimes tired.
We need to see the doctor to make sure all is well with you.
I agree, ma'am. It disrupts my day at school too much.
At the clinic, Dr. Yobo decides to conduct a few tests to confirm his diagnosis about Jude. He opts to do a blood glucose test to check Jude's blood sugar level.
So, according to the results, you have type 2 diabetes.
Type 2 what?
Diabetes is a condition wherein the blood sugar level in your body becomes too high. In type 2 diabetes, there is insulin resistance or relative deficiency of insulin that results in excessive blood sugar, which in turn can lead to other health problems. In short, type 2 diabetes is a metabolic condition in which the body's insulin is either ineffective or relatively insufficient to deal with the blood glucose levels.
Dr. Yobo continued to explain to Jude about his condition.
The exact cause of diabetes is not known, but genetics, family history of diabetes, and an unhealthy lifestyle seems to be the most common and important causative factors.
What happens if diabetes is not well controlled?
The long-term complications of diabetes can include the following: stroke, blindness, heart disease, kidney failure, sexual dysfunction, and amputation. Type 2 diabetes is a chronic condition in which there is bodily resistance to the insulin produced by the pancreas, and it typically manifests in adolescents. Managing this will require medication and regular blood sugar tests as well as a healthy lifestyle.
It was tough to accept for Jude at the beginning.
My days with sugar-coated donuts and sweetened drinks are over.
But he had support for his new lifestyle. The school made sure his lunch was not full of the usual sweet things, and his friends reminded him to take his sugar test and play football or basketball with them regularly to keep healthy. His parents were also supportive, preparing healthy meals for him and removing all sweet and sugary drinks from the house. In fact, all family members became sugar-free too. Back in school, Jude and his friends soon formed a Sugar Police Kids Club to raise awareness about the condition and to help others who had diabetes or were pre-diabetic so they can prevent and early diagnose it.
Try to go sugar-free in your meals. Eat more fruits and veggies, along with moderate daily exercise. Our lives can be so sweet without sugar too. Let's all work together to fight diabetes every day.
Merck Foundation. No more diabetes. Reverse diabetes. Goodbye diabetes. We can make it work.
Now let us call our fourth speaker, Dr. Ruben. He's an executive board member and chairperson, Namibian Medical Society, senior medical superintendent, Intermediate Hospital Oshakati, Namibia, and also our Merck Foundation alumni. Dr. Ruben will be talking about promoting a healthy lifestyle and raising awareness about prevention and early detection of diabetes and hypertension. He will also highlight on how to report it to the community. Dr. Ruben, sir, please.
Research has shown that after lunch, most of the time presenters talk to themselves. I hope it's not the case. I brought you warm greetings from one of the oldest descent in the Namib descent, and second largest canyon in the world also, the Fish River Canyon. And then the sentiment of our greetings from the Atlantic Ocean meeting the Namib Desert. So that is Namibia. So thank you, Merck Foundation, for this opportunity. My task, in the interest of time, actually have been done through the previous speaker of the morning sessions, who have touched on the most aspect that we are talking, and the animation that you have just played also covered my part of my presentation. Well, I assume the majority of the people here are media practitioners, and my role here is to join other colleagues who have presented before to see how we punctuate the role of the media practitioners in spreading the message about public health. It is really, undebatable that mass communication form a very important part of the implementation of health programs. And with my presentation, I will not dwell so much on the condition and pathogenesis, as I'm not talking to most of the clinicians here, but we want to tackle the last part there, how to report it to community. How do we bring in these very important stakeholders, that is the media practitioners, into reporting, since we are dealing with preventative and promotive medicine. So I want to underline three things that the involvement of media will lead to three very important things. One is to get the correct information and timely information to the communities. Two, it will provoke change in attitude and values, health attitudes and health values. And then the last one, we want to cement and establish new health behavior with a view of sustaining such behavior for all. Yeah, I think the animation that was played have already explained most of these things. We are talking of non-communicable disease, which are actual chronic condition not caused by infectious agents, or otherwise in other words, they call it non-transmissible conditions. The examples are cardiovascular disease, diabetes, cancer, chronic respiratory diseases, and by statistic, globally, we have those type of diseases responsible for 74% of death. That's according to WHO in 2024. So these are risk factors as they were outlined in that previous play that we have seen: genetics, lifestyle, poor nutrition, tobacco, alcohol use, and other many things. And then we look specifically on diabetes mellitus, which is a chronic condition with blood sugars. There are two types, where you have type 1. It was already explained also that it's either you don't have enough insulin, or you have insulin, but then the body is not responding to that insulin. And then there is also diabetes during pregnancy. We know during pregnancy, there are a lot of physiological change that happen with a woman's body. And this includes also change in hormone. You find that change in hormone may lead to the body being resistant to the insulin, with the view that there is a second person who must benefit from the sugar. Then what are the symptoms? They also depicted there: frequent urinations, you are drinking a lot, you are urinating a lot, you have this, hunger, fatigue, blurred visions. Those are all symptoms. But what are the risk factors? Obesity, living a sedentary life, nutrition, we talked about eating unhealthy, the age, the genetic, very important, genetic predisposition. And those are some of the complications. And on prevention, it was also shown there, regular exercise, health diet, stay away from substance use as tobacco, alcohol, and maintain a normal weight. The second one that we are talking about from the NCDs is hypertension. Sometimes we call it a silent killer, which is defined by your blood pressure measured on 2 occasions, 2 different days, with the upper reading, which is a systolic of equal or more than 140, and the diastolic, which is a lower reading of 90, more than 90. So with this, it carries the risk of stroke, heart attack, kidney diseases. Often asymptomatic, it has some symptoms such as headache, dizziness, but the definite way to diagnose hypertensive is through measuring blood pressures and monitoring. What are the risk factors and how do we prevent them? Risk factor is, I don't know how many of you have taken enough salt during lunch. So extensive use of salt, stress, obesity, alcohol, genetic, we talked about that. On prevention, we need to monitor our BP, diet, exercise, reduce. And once you are diagnosed, you must, adhere and comply with the treatment plan and attend to your follow-up with your doctor. Now we come to the key question. I think why I'm here. The roles of media in community health education. This, I think the following presentation would delve too deep into that, but I should highlight 4 things. Is to disseminate accurate information, and I added there that on time, because this information can also be fatal, just like undiagnosed hypertension. That's why I address misinformation and myths. I think you can relate from COVID-19 pandemic, what was happening there. Empower with prevention strategies as we discussed them earlier, and collaborate with the professionals. For you to report accurate information, you must get from the right source. The collaboration is very, very important. And you have heard from the area presenter, one of the colleagues said, sometimes they want to give more information, but they don't have time. So you are basically our bridge community and the healthcare workers, those who don't have time to go and pass on the message. What are the approaches that we need to employ for us to make sure your assistance is a quality one? First of all, you need to know your audience. I think there were lots of highlights on cultural aspect in the previous presentations. We need to contextualize cultural aspect into our planning, implementation, monitoring, and evaluation. We need to be cultural sensitive to our target communities, spiritual sensitive also to our target communities, such that we use the correct language, because it's of no point going to spread information in the language someone don't understand. Try to use visual and real stories. If you can relate with our fight for against HIV/AIDS, we always have people, narrating real life stories. Comes to cancer, you always have cancer survivors, TB survivors who are narrating real stories, and it makes a difference in passing on our message. Promote peer educators and dialogues. Have community champions. Sometimes the message is not getting across because the people don't know you, the people don't trust you. But once you employ people from within their community, people that they spend time with, the people that they've grown up together with, you may realize that it's making quite a difference. And then you need to monitor communication outcome. In conclusion, diabetes and hypertensive are preventable. And I think there were also discussion around, a bit of health financing in the previous presentations. That no, we are not doing this as developing countries because of ABC, because of the cost, because of the accessibility. It is very expensive to focus on creative measures. That's why it's very important for us to put more effort on the promotion and the preventative measures of public health. And then we can win. Lifestyle change and reductions are key. And I think medias, we already given your flowers in the morning. I'm just adding another bunches of flowers that medias, our key partners, are in the public health programs. There is need to strengthen collaboration such that we give out accurate message, and then you go and represent and pass on the message to the targeted audience. So with that, let us be the change agents for the healthier communities.
Thank you very much. Thank you very much, Dr. Ruben. So you all agree with me that the role of the media cannot be overlooked in handling these issues: hypertension, diabetes, raising awareness on infertility stigma. So now is the time for us to talk about the role of the media in reaching out to communities at grassroots levels and raising awareness on health and social issues like infertility stigma, girls' education, girl-child marriage, gender-based violence, female genital mutilation, and etc. To do that with us or to take us through is Mr. Jean-Luc Emily. He was a senior journalist with Mauritius, but now he is a senior advisor for the Ministry of Gender, Equality and Family Welfare at Mauritius. You're welcome, sir. Let's welcome him, please.
I just hope I can give a journalist answer to what you just said before. Yeah, Dr. Ruben and earlier Dr. Francesca talk about the important role of media. This is really a big issue because every time we gather in the Merck Foundation seminar, this problematic is raised, the role of media. And I think it's very important to emphasize on the role really of the media, of the press. Well, in fact, media has definitely a key role to play. Why? Because media people, we reach people from the community, from grassroots. We are those that the community, in fact, are trusting. And when I was listening to Dr. Ruben, I was thinking about a theory in mass communication, that is the hypodermic needle theory, and which is also called the magic bullet theory, which says the metaphor of hypodermic needle theory is injecting something in the mind of the people, of the audience. What media really does, media inject information, inject a message in the mind of the population. And even if there are critics from this theory of Laswell, which was introduced in 1923, but I think it's actually our role is to disseminate good information, trustful information in the mind of people. And I think our role in reaching out, it should be at grassroots level. Maybe we will start the first slide. This essential role, I think, today people from communities from African countries, European countries have been trusting on media. And it's not an hazard that when we see surveys, when we see studies about how people trust media, I think organization, institutions that come first on the top list, it is media organization. And in so many countries, it's still be the top leading institutions in surveys. Well, health-related communication in the media have aimed to change the health behavior of the population by creating awareness and promoting prevention. We just said about how to change health behavior. All realized how much it was important during COVID period, how it was important to tell people we should wear a mask, we should wash our hands. Later in the slide, you will see the Mauritian situation during COVID, how a doctor has been able to go viral on the social media, just learning people how to efficiently washing hands during the COVID period. Well, the prevention purpose of, I think, media is not just a messenger, it is a catalyst for social transformation. Beyond the transmission, media is actively shapes what we can say social attitudes. Today, if I can, maybe we'll go to the next slide. The transformation, the Mauritian experience. I just some days back experienced something which is very important about the transformative power of media. Earlier we were talking about adoption and foster family. On the 30th of May, we were celebrating the World Foster Day. It's the first time in Mauritius that this World Foster Day has been celebrated. And I have purposely chose a media which has not a big, I would say big audience in Mauritius, but this media who had a penetration in the rural areas, most in rural areas than in urban areas. And after one day of sensitization, we managed to register nearly 200 families, couple with infertility problems that wanted to foster children. We have a fostering system in Mauritius, and my ministry where I work has this responsibility. Sometimes people were not aware of this foster system. And through this media campaign, through this, let's say, media, we've chosen to broadcast live a focus group, which was on the media on this particular day from this radio. And this have, in the population, we have seen messages on social media, on Facebook, on Instagram, the testimonials from parents, from those young kids who were in the system and now are adult, with their testimonials about how they feel when they were fostered by my Mauritian family. It helps to understand that those kind of information needs to reach the society through grassroots level, because so many times we have good information, but we didn't manage to have these informations to the communities. Ensuring that information reaches even the most marginalized groups. You know, sometimes we as media people, I say we, I still think I'm in the media, but we have the tendency to think that big information that made the headlines, that are the news that people want to listen to. In fact, it's not really that true all the times. Maybe sometimes an information which is basic for us as journalists, this information can be of vital importance for the society. Maybe we should rethink our ways of the hierarchy of information in our mind first before giving this information to people. I've taken this picture to tell you how in Mauritius, the radio, even if the trust in institutions is still declining from generations, the Gen Z in Mauritius still trust radio as a means of media to obtain news information. And I think for all of us here from African countries mainly, radio still represents a main source of information for the community. Grassroots communities often face systemic barriers to information. Media bridges the gap. We realize in remote rural areas in some African countries where electricity is a big problem, where access to internet is also a big problem, where we can have a radio with batteries, people can access to information. We should, I think, bear in mind that radio still matters for a lot of people in the community. Limited access to technology. Today, the limitations of mass communication is technology because everything goes through technology. In so many countries today, I would say that internet access is sometimes very low. The penetration of internet in some societies, in some families, extremely low. And this is where people always have information. And I think government, the authorities need to address this problem because this is where information can be given, and which is also where misinformation is present. Today with the fake news, we as journalists needs to give a true face of information and to address the problem of misinformation because sometimes information from journalists on the social media is confond. People, if we don't give an information that the citizen journalist is giving, people sometimes does not trust true journalists or true media organization. They tend to think that what this citizen journalist is saying is the right information. And sometimes they accuse media mainstream of covering government, not giving good information because we are not addressing this issue. In fact, it is not an information. It's rumors. It's not yet news. And we as journalists need to address this kind of problem as misinformation. Action for the community. How the media can address those kind of issues that I just said, to act quickly, to act decisively, and to communicate clearly. Sometimes people in the communication field tend to be those who don't know how to communicate with people. We need to do a retrospection on the way we communicate, on the way that our message reach the community. And sometimes it's important to take decision rapidly, to act quickly, because a news which is at this very moment important, tomorrow will no longer be important for the community. We need to address those kind of problems decisively and to act quickly. Media channels at the grassroots. How to communicate, how to reach a grassroots. Traditional media, you know, I said earlier, the radio, local newspapers. I don't know, there are people from newspaper in the room. Newspaper from, I know 20, 25 years ago, we are predicting the death of newspaper. The papers still been alive. It's still, yeah. In fact, we say, you know this legendary quote, video killed the radio stars, but video came and the radio stars still exist. I think local newspaper will still exist. These are traditional manners to reach the community. We should continue to give information for these channels. Digital media today, everyone is on a WhatsApp group. We have been connected through WhatsApp before coming to this seminar, and we still be connected. Facebook Lives today are the way people follow information. What's happening in India with the plane in a fraction of second, people got this information around the world. This is the capacity, the how Facebook Lives can connect people. Mobile health applications in some countries they do have it, and hybrid models also, radio plus short message, feedback loops, the TV plus community forums are also ways where we can reach grassroots. We can say, I told you earlier, the radio still is a channel where people obtain information. Why radio? The answer is simply that radio still has the widest audience footprint, reaching millions who have no access to the internet. I talked earlier about the capacity of the radio, where the technology, where internet connection are very low. This is a case study in Mauritius. Les Enfants de l'Avenir is a campaign aired on the national channel and social media to raise awareness on child protection and GBV. And it integrated storytelling of survivors and expert commentary on this issue. The result is 40% increase in hotline call at the Ministry of Gender Equality. The hotline is 139. Within 3 months, we reach 40% increase in hotlines. That's to say that how campaign sometimes is very important, reaching through social media. Radio reaches the most number of people. Radio does not run out of airtime or data. Radio is democratic. Radio informs and educates. That's the reason why we should, maybe I'm from the radio, basically. That's why I'm doing my advocacy for radio. Three other case studies. Rodrigues is a small island next to Mauritius, where the community radio talks about infertility stigma and promote maternal health. It's still aired those kind of shows. Maybe it's not, fashion, talking about this kind of programs at 11 to noon in every day, but still this kind of information reach the communities. And you have the midwives and also the faith leaders co-hosted programs to build a trust within the community. Anyone from Kenya here? You know this Let's Talk, the Let's Talk drama, which tackle all about things that we have been talking: child marriage, reproductive health, FGM, broadcast in local languages, interactive SMS posts, which led to 20% increase in girls returning to school in pilot regions. Another example in Nigeria, someone from Nigeria? No. Earlier, we were talking about FGM and FGM social media campaign, which was an international campaign, had influence in 5 states, Ebonyi, Ekiti, Imo, Osun, and Oyo, to accelerate the abandonment of FGM. Those campaigns, which can be used through social media and local media, newspapers or radio, or even television, which can have a decisive impact on the community. Live phoning programs where we have ministers. It's very usual in Mauritius having ministers on the setup, have doctors on setup to have live phoning programs where interaction can be made. Radio and digital using our different platforms, interviews with political ministers, health professionals. That's what everyone does right now. Radio goes where newer technologies can't, beyond electricity, beyond a mobile signal, beyond literacy, because this is another reason why I put emphasis on radio, because sometimes we speak native languages on radio, and on local newspaper, we tend to use either French or English. And why radio is so impactful, because it reaches people where they are with the languages that they used to speak. I was talking about this interview of Dr. Sunil Ganesh, who is an eminent cardiologist in Mauritius. During COVID-19, he was talking about the effect and so on. And he put away his field as cardiologists to talk about how people, there's an interview, how people should wash their hand after everything. You go to somewhere, you go to the restrooms, and how to wash your hands. In a couple of hours, this interview posted on Defi Media reached 116,462 views. For Mauritian audience, in a couple of hours to have this kind of views, it's magic. It's magic. And I think those kind of stuffs from medical practitioners on very simple things can make the difference. Media role in health awareness, we've talked about influencer today. The new trends is about hiring influencers, because the younger generation, if you go to school to have someone from the medical sector talking to them, they won't listen to the message which is being broadcasted. I think today ways reaching the younger generation is by using influencer advocacy, celebrities sharing personal histories on infertility or GBV, community health journalism, local reporters trained to cover taboo topics. Earlier, I was talking about taboo topics, about topics which are very sensitive, and real-time information with social media. This lady you see on the picture, during COVID period in 2021 in Mauritius, her family organized a prayer where there were at least 300 persons attending this prayer. And it happened that she was tested positive for COVID. And it was known that people who were present in this community could have been positive, could have contracted the COVID-19. And what we did with this lady, she was on the radio, maybe the next slide. She was on radio telling people that, I'm COVID positive. All those persons, 300 persons who were in my house this day for this prayer, you should go for a test because it is important. And from the 300 persons, in fact, it was the very beginning of the COVID-19 second pandemic in Mauritius, because at least 150 persons from this activity was COVID positive. And she was interviewed on the radio. 49,000 people at a time reaching this information. It is for us in at that time in 2021, it was the highest reach of views for a Facebook Live. Therefore, this can be situation where we can use Facebook Live, use testimonials of people to help in disseminating information. The building of network, during COVID, we have been doing programs like that to reach biggest audience. Crisis communication is considered to be an integrated part of disaster health response. Like in COVID, we should communicate when there are crises. It is important to know how to communicate during crisis. The humanitarian side of the story, communication and access to reliable information can facilitate health recovery and reduce mortality after disasters. From a historical perspective, public radio has been used worldwide as a communication method in emergencies. Every one of us here, you know how in your respective country, how the public radio has been playing a key role during natural calamities in Mauritius, the cyclonic weather, cyclonic conditions during the summer days, November, December, when the private radios didn't exist in Mauritius, people was listening continuously for hours to national radio to have information. Today, we all have Facebook when there are no light. That's a big issue for having your phone with your battery and so on. But radio, at that time, public radio was still something very important, which is always a viable source of information. I wanted to talk about something about gender-based violence. 84% of people in Mauritius from this survey say that all forms of physical and emotional abuse towards an LGBTQA+ person are perceived as unacceptable. This is a very taboo issue in Mauritius, And this survey gives some information about how people perceive information and how people get information. And it's the first time that this is a very, very high rate, 84% of people that who acknowledge those kind of violence, which are perceived as unacceptable. We never did it before, and we never had such an information. Through surveys also, it's a way to communicate in the media and communicate results of surveys. These are the main findings. It's 86% of respondents believe that gender equality is important. You would say it is a normal fact, but in Mauritius, it's always a taboo, and it's the first time those kind of information was on newspapers, on radio, and on television. The role of media in preventing gender-based violence and crimes. I think we should prioritize survivors' testimonials, prioritize their safety also sometimes, confidentiality, and the right to dignity. Because sometimes we can see in newspapers photography, pictures of we don't tell the name of a person, but we publish the house of the person. We don't say the name of a little girl, but we put the name of the parents. We as media people, we should maybe have another kind of approach to this kind of information. At 13, the place to be for a girl is at school, child marriage. This is another issue. I think media has a role to press authorities to raise the age of marriage in some countries. In Mauritius, recently, this has been an issue. Now it's at 18. Before it was 16 for so many years. And now this is an aspect where media can influence decision from the authorities. Those kind of subjects should be the headlines in your papers and your radios. Girls are not brides; they are school children. Yeah, child marriage is defined as a marriage of a girl or boy before the age of 18. How many of you in your countries is still not 18 years for the age of marriage? You know, yeah. In which country? Zambia. Yeah. There's a need, as the UN said, as UNESCO also, to force authorities to raise the age of child marriage. Bridging the gap. I think most of us know where to go, how to reach communities, invest in community media, promote media literacy, foster cross-sector collaboration, media plus health plus education and the civil society, and support survivor voices, because sometimes people want to give testimonials, they want to express themselves. If we don't open our column or even our radio waves to those people, maybe they won't be able to address themselves to those experiencing same situation as them. How to inspire trustful community, be responsive, be reliable, be motivated, and also be active. Thank you.
Thank you, Mr. Jain. It was indeed a good session, I guess. Everybody liked it. Before we call our next panel, I would like you to all watch the promo of Our Africa by Merck Foundation TV program. Our Africa is a Pan-African TV program that is conceptualized, produced, directed, and co-hosted by Senator Dr. Rasha Khalej. The program features African fashion designers, singers, and prominent experts from various domains with the aim to address and raise awareness on various sensitive health and social issues. The show has been broadcasted into many countries in Africa, including Malawi, Botswana, and Namibia. Currently live on NBC in Namibia.
Senator Dr. Rasha Khalej and creator of Our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma. Yes to girls' education. We want to stop gender-based violence full stop. Number of child marriage will double by 2050.
We will now proceed for the panel discussion. The topic for the panel discussion is how can media be a creative and honest tool to address our sensitive and critical social and health issues on a daily basis. Let us welcome the panelists for the session who will be sharing their views on the topic. Mr. Pedro, Ms. Giselle, Vice President Cabo Verde Journalist Association from Cabo Verde, Ms. Fatima, Editor, Defy Media, past Vice Chairman, Media Trust, Mauritius. Please, but we can start our session.
Hi, everyone. Very happy to be back with Merck personnel and all of you here again. I'll start. The topic of the day is how can media be a creative and honest tool to address sensitive and critical social and health issues on a daily basis. So my name is Fatima Kapere, and I'm a journalist in Mauritius. I have been journalist for 20 years, and over the years, I've seen how media, when used thoughtfully, can change lives, especially when we deal with sensitive social and health issues. I think you're all you will all agree with that. The responsibility of media, I'll start by that. Media is a powerful platform. This also, I think you all agree. That's why we do this job as well. But with that power comes responsibility, not just to inform, but to educate and amplify the voices that are often unheard. Every day, we are faced with issues such as domestic violence, mental health issues, gender inequality, and access to healthcare. Those are subjects that are sometimes silenced by stigma or social discomfort. I won't be telling you anything new today. We are in the afternoon after the lunch, and all the experts since this morning have been telling us the same messages. Bottom line, we need to be aware of our duty. So it is our duty to break these silences, but with honesty and with sensitivity. How do we do that? We can give a voice to these issues. We don't just tell stories to people, but we put forward real great issues. We open minds, and sometimes we even influence policy, just like experts before me told us. Let me share a concrete example. Where I work at the radio station in Mauritius, we host a program called Explicuca. In English, Tell Us Your Problems, where we listen to those, especially in vulnerable situations, the one often overlooked by the system. Through this platform, we also connect them with resources, NGOs, and public institutions that can help. We even do a follow-up afterwards. After the program, the radio program, we even do a follow-up to ensure that their problems are resolved. And this was for the radio and for our print media. For our print and digital edition, we publish health-focused articles, topics like eating disorders, cancer, fertility struggles, and palliative care, which is more and more talked because of cancer as well. But we always have to keep in mind the emotional and cultural dimension of our audience. This as well has been talked earlier. This shows that media does not have to sensationalize to be effective. We can be effective without bringing hot titles. And my last slide, my last topic will be about creativity with integrity. I think this is all about today's topic. So creativity is crucial, especially today where attention span are very short, but it should never come at the cost of truth or dignity. We have to fight fake news. This also has been spoken earlier. We have seen as well the challenges we had during COVID-19, how so much misinformation was spread, and how the media took part in putting forward the truth, the real information. And lastly, I will end with, we need to know our audiences and adapt our messages. From my point of view and from where I am, we have a health website dedicated to health and wellness. We have this year 2 new programs that we launched. The first one is in French, Côté Cœur. Côté Cœur in English is all about the heart health. This is a daily and a weekly program that we put forward every messages regarding the heart. It's very specific. And the new one, this is the very interesting project I've worked on. In English, it's in French, it is le dictionnaire médical. And in English, a health dictionary where we explain medical words, complex medical words. I think the doctor will agree with us. We have medical words that not all people understand. Not my grandmother or 70 will understand around cancer, around hypertension. So, and going to the doctor, you have maybe 15 or 20 minutes with one patient. You don't have the time really to break down those information, those complex words. This is where we thought at our media house that coming with specific shows, trying to narrow things and explain every day one word can in fact build up and make that education for the public. So that was all for me. Thank you very much.
Tá bom. Bom, boa tarde a todos e a todas. Eu sou o Pedro Miguel, venho de Angola, e quando li o tema que propuseram-nos para apresentar, para discutir e refletirmos juntos, eu alterei lá uns aspectos, né? Fui mais direto e sensíveis no cotidiano das comunidades. As questões sociais têm muito a ver com a própria saúde, temas ligados à saúde e à educação. Mas pensei, o que seriam então as questões sensíveis? Bom, e eu pensei logo, bom, as questões sensíveis provavelmente têm a ver com política. Bom, será que é isso que se pretende? Está bem, então vou tentar escrever um pouquinho sobre aquilo que a própria história dos mídias nos apresentam como objetivos que justificam a sua razão de ser, a importância para as comunidades. Todo aquele que estudou ou estuda ciências da comunicação ou mídias saberá alencar os objetivos que circunscrevem em informação, recriação e formação. Destes 3 objetivos, vamos nos cingir na formação, porque entendemos ser este o centro do objeto social dos mídias que melhor se enquadra ao tema. Mídia como ferramenta criativa na abordagem de questões sociais e sensíveis no cotidiano das comunidades. O caráter formativo dos mídias, ou dos meios de comunicação social, enquanto instrumento de mediação social, visa a promoção de valores culturais, influencia na mudança de atitudes dos ouvintes, telespectadores, leitores e cinéfilos. Bom, eu que trouxe a questão do cinema, porque o cinema também é mídia e todo realizador espectador do cinema deve ter sempre em conta a temática ligada à promoção de valores. Então, a Fundação Merck manifesta de forma contínua a preocupação da necessidade de uma educação integral das comunidades por via da comunicação social tradicional ou digital, de forma de imprensa, televisão, rádio, cinema, etc, etc. Em matérias essencialmente ligadas à saúde pública, às questões do gênero, violência sexual e doméstica, a infertilidades e doenças infecciosas, os casamentos infantis, o mesmo se pode aferir da problemática referente à pobreza material e espiritual. Pretende-se com a inclusão dos mídias, no caso, meios de comunicação social, nos processos e objetivos da Fundação Merck, maior disseminação de informação vital e essencial em locais periféricos, onde o Sistema Nacional de Saúde, os seus resultados são incipientes em relação aos grandes centros urbanos, níveis de alta sustentabilidade econômica, potencializando estas comunidades de conteúdos essenciais em matéria de saúde pública, que a população possa, por si mesma, dar resposta aos problemas de saúde e outros com poucos recursos ao seu alcance. As formações humanas integrais realizadas pelos meios de comunicação social transcendem um aspecto meramente informativo, como o facto noticioso que ocorre em uma determinada comunidade concreta. Os mídias permitem a promoção e democratização de instituições comunitárias e o desenvolvimento humano na sua dimensão espiritual e fisiológica da alma e o corpo. A formação é componente humanizante dos mídias, que permite ao indivíduo desenvolver a capacidade crítica e valorizativa do bem comum, ao mesmo tempo que desenvolve também o princípio de pertença e identidade, o sentimento de responsabilidade social e comunitária. Para que os mídias correspondam com a exigência formativa como ferramenta criativa na abordagem de questões sociais e sensíveis, é necessário que ela se manifesta, seja capaz de acolher as diferentes manifestações culturais e ideológicas. Exato. Então, para que os mídias correspondam com as exigências formativas, como ferramenta criativa na abordagem de questões sociais e sensíveis, é necessário que ela se democratize, seja capaz de acolher as diferentes manifestações culturais e ideológicas construtivistas da pessoa humana, expurgando todos os preconceitos suscetíveis à degeneração da comunidade. A democratização permite que emergem novas formas e técnicas que concorrem para a educação ontológica do homem no espaço e tempo, sem descurar a possibilidade iminente de promover a consciencialização para uma vida social, política, econômica e biológica saudável. As novas tecnologias de informação e a revolução tecnológica vieram por si só alterar o formato dos meios de comunicação social em massa, tornando-os mais eficientes na divulgação de conteúdos, não só informativos, como também aqueles de pendor pedagógico. O jornalista deve ter a capacidade de conhecer o meio social, sobretudo as debilidades cognitivas das pessoas da sua comunidade e as necessidades formativas, cabendo-lhe elaborar uma grelha temática como a educação sexual, violência doméstica e sexual, gravidez prematura, casamento infantil, temas que em muitas comunidades ainda é tabu. O jornalista deve ser o facilitador, deve-se convidar especialistas de diferentes áreas do saber em saúde pública, sociedade e economia, sobretudo nos programas radiofônicos e televisivos com maior audiência. Isto proporcionará à comunidade o esteio para aprendizado e libertação da ignorância involuntária. É importante que se reconheça que em muitas comunidades do nosso continente, em particular Angola, meu país de origem, apesar dos avanços tecnológicos dos meios de comunicação social, com um satélite próprio, ainda existem comunidades desprovidas de uma televisão e de internet. Para estes casos, a responsabilidade é do Estado, que deve criar condições e logo que existam, numa primeira fase, construir-se, naquelas comunidades onde não existem, construir-se jangos ou moanza. Jango ou moanza são lugares onde se pode congregar pessoas, onde poderá ser colocado uma televisão ou um ponto de internet. Isso vai permitir que a comunidade possa ter acesso à informação. Já para terminar, vou trazer aqui uns dados, que um dos problemas da nossa ignorância em matéria de saúde pública tem muito a ver com a falta de literacia. Quer dizer que a nossa comunidade ainda é analfabeta. Daí, os meios de comunicação social também podem ser um instrumento para a escolarização. Como, por exemplo, como já o Moçambique tem programas televisivos, tem rádio, que são uma escola, tem horas próprias para se ensinar as pessoas a lerem e a escrever. Angola também imitou Moçambique, sobretudo na época que tivemos a Covid-19. Com certeza que, ao transformarmos também um espaço de aprendizagem científica, etc., os mídias poderão sim ajudar para que as pessoas saiam da ignorância em que se encontram. Muito obrigado a todos. Thank you. Merci beaucoup.
My name is Gisela. I'm more than 20 years I've been a journalist, editor. I'm Portuguese, but I almost 20 years in Cabo Verde, where I live, where I work, and I will try to bring you a little bit of my experience in Cabo Verde. I don't have a magic potion to how can we improve and give a higher contribute to the healthcare in our countries, but I start asking something for you to think about that, and in the end you will telling me is that when was the last time that we wrote something, a big report on television or radio or in the press. Last time we did a report about healthcare in our countries, because sometimes we only write about healthcare when there's a pandemic, a huge virus, or a massive death, when a tragedy happens and is related, connected with the healthcare, because healthcare is a human right, and sometimes population don't have that awareness that it's a human right. They have the right to have access to healthcare, even if it's combating the cancer, diabetes, hypertension, infertility, like we heard this morning, because in Cabo Verde we have huge problems of diabetes too, and hypertension is been increasing in the young people, in the older people too, because we is connected with our health habits of life and the food we eat, and if we practice sports, and it's been increasing in Cabo Verde. I don't know the other countries. In Rwanda, we heard the colleague is saying that this is being increasing too, but it's a reality. And how can we improve that, and how can we give information to the population? We must work together and near the communities, the rural communities, not in the urban space, because in the urban space, in the cities, population have more access to information. They have more access to internet, they have more access to television, they have more access to radio. But in the rural communities, there's a lack of communications, so of information. So we need to get connected with the rural communities, because we journalists, we are the voice of those communities. If they have a problem, we must be there to help them to I get lost now, I'm sorry. Vou tentar falar um pouco português. O que eu estava a querer dizer é que é muito simples. It's very simple. Yeah. Aham. É muito simples. Nós realmente, nós enquanto jornalistas temos a obrigação, temos a obrigação de dar voz às pessoas. Às vezes nós ficamos perdidos um pouco nas agendas políticas, e esquecemos-nos de ir aos centros de saúde, de ir aos hospitais, e tentar ver como é que as pessoas se sentem, quais são os seus problemas, porque hoje em dia, nós, devido à globalização devido à globalização, por vezes nós ficamos muito concentrados nas redações e esquecemos de ir ao terreno. Exatamente, e é no terreno, nas comunidades, que nós ficamos a sentir realmente o que é que se passa. Porque muitas vezes nem sempre a população tem como chegar à comunicação social, especialmente, portanto, na minha humilde opinião, é um dever nosso da mídia chegarmos às comunidades. Caso contrário, é difícil sermos as suas vozes e transmitirmos. Cabo Verde tem apostado muito na formação de jornalistas, incluindo com o apoio da Merck Foundation. Temos tido alguns treinamentos em jornalismo de saúde, como forma de termos consciência precisamente daquele que é o nosso papel e como podemos, porque uma coisa fundamental é democratizarmos o acesso à saúde. Exactly. Relativamente às questões aqui que vimos esta manhã, em Cabo Verde, em Cabo Verde também temos, como já disse, diabetes, hipertensão, violência baseada no género, domestic violence, children marriage too, because we have a lot of immigrants from the African Occidental coast, and they have some practices of genital mutilation too, and it's a huge problem there too. Okay. I want to try to speak English, but but the main key, I'm almost ending. The main key is to give voice to the communities, the rural communities, because there's a huge lack of internet in the rural communities in Cabo Verde. I think it's the same in other African countries. We have to improve the capacity, availability of the journalists, because if sometimes we don't have all the conditions, even if we want to we want to go to a hospital or a medical center in the other side of the country or other side of the island. Cabo Verde is 10 islands, each one has their own specificities, and there's only two central hospitals in 10 islands, only two central hospitals. It's very difficult. We have lack of specialists, medic specialists, doctor specialists. So that's why in the morning I was saying that frozen eggs is very expensive there. There's no frozen eggs in Cabo Verde. We have to fly to other countries if women want to do that. So that's why I was saying it's very expensive, and it is. So, and then there's a very important other thing, I'm almost ending. If we want to pass the right information, we have to have access to the right information. Doctors can give us the right informations, but they have to simplify the words. That's the problem. When our colleague was saying in the morning, synthesizing is help us to have the more simplified words to pass the message to the population, because there's a lot of technical medical information, and we need to simplify. Otherwise, people won't be able to understand. That's the main issue. I could say so much, but it's okay. Thank you very much.